From flames to relief, how to extinguish gastritis symptoms for good. Gastritis is a common digestive disorder characterized by inflammation of the lining of the stomach. It can be acute, lasting for a short period, or chronic, persisting for months or even years. Gastritis can cause discomfort and lead to various digestive symptoms. In this article, we will discuss in detail the causes, symptoms, and effective treatment options for gastritis. Causes of gastritis. A. Helicobacter pylori, H. pylori, infection. This bacterium is one of the most common causes of gastritis. It can colonize the stomach lining and trigger inflammation. B. Nonsteroidal anti-inflammatory drugs, NSAIDs. Prolonged use of medications like aspirin, ibuprofen, and naproxen can irritate the stomach lining and cause gastritis. C. Excessive alcohol consumption. Alcohol can irritate and inflame the stomach lining, leading to gastritis. D. Autoimmune disorders. In some cases, the body's immune system mistakenly attacks the cells of the stomach lining, causing autoimmune gastritis. E. Stress and anxiety. Although not a direct cause, chronic stress and anxiety can exacerbate gastritis symptoms. Symptoms of gastritis. A. Upper abdominal pain or discomfort. This is a common symptom of gastritis, often described as a burning or gnawing sensation. B. Nausea and vomiting. Some individuals may experience feelings of nausea or may vomit, especially after eating. C. Loss of appetite. Gastritis can cause a decrease in appetite and a sense of fullness even after consuming small amounts of food. D. Bloating and belching. Excessive gas production in the stomach can lead to bloating and frequent belching. E. Indigestion. Gastritis can cause indigestion, resulting in symptoms like heartburn, acid reflux, and a sour taste in the mouth. F. Black or tarry stools. In severe cases, bleeding in the stomach may occur, leading to the presence of black, tarry stools, a sign of gastrointestinal bleeding. G. Fatigue. Chronic gastritis can cause fatigue and a general feeling of weakness. Diagnosis of gastritis. A. Medical history and physical examination. A healthcare provider will assess your symptoms, medical history, and perform a physical examination. B. Blood tests. Blood tests can detect the presence of H. pylori antibodies or evaluate markers of inflammation in the body. C. Stool tests. Stool samples may be examined for the presence of blood or H. pylori infection. D. Endoscopy. A thin, flexible tube with a camera, endoscope, is inserted through the mouth to visualize the stomach lining and obtain biopsies for further examination. E. Imaging tests. In some cases, imaging tests like an upper gastrointestinal, GI, series or abdominal ultrasound may be recommended to evaluate the stomach and surrounding structures. Treatment options for gastritis. A. Medications. Antacids. These can provide temporary relief by neutralizing stomach acid. Proton pump inhibitors, PPIs. PPIs reduce stomach acid production and promote healing of the stomach lining. Antibiotics. If H. pylori infection is present, a combination of antibiotics is prescribed to eradicate the bacteria. Cytoprotective agents. Medications like sucralfate or misoprostol can help protect the stomach lining. B. Dietary modifications. Avoid trigger foods, spicy foods, acidic foods, caffeine, and alcohol can worsen gastritis symptoms and should be limited. Eat smaller, more frequent meals. Consuming smaller meals throughout the day can help alleviate symptoms. Avoid irritants. Smoking and nonsteroidal anti-inflammatory drugs, NSAIDs, should be avoided. Consume a balanced diet. Include foods that are gentle on the stomach, such as lean proteins, fruits, vegetables, and whole grains. C. Lifestyle changes. Reduce stress. Engage in stress-reducing activities like exercise, meditation, or yoga. Quit smoking. Smoking can worsen gastritis symptoms and delay healing. Limit alcohol intake. Alcohol can irritate the stomach lining, so it's advisable to drink in moderation or avoid alcohol completely. D. Management of underlying conditions. If gastritis is caused by an underlying condition like an autoimmune disorder, addressing and managing that condition is crucial. Prevention of gastritis. A. Practice good hygiene. Wash hands thoroughly and avoid sharing utensils or personal items to reduce the risk of H. pylori infection. B. Use NSAIDs cautiously. If NSAIDs are necessary, use the lowest effective dose for the shortest duration. C. Moderate alcohol consumption. Limit alcohol intake to reduce the risk of gastritis and other digestive problems. D. Manage stress. Implement stress management techniques to minimize the impact of stress on the digestive system. Risk factors for gastritis. A. Age. Gastritis can occur at any age, but older adults are more susceptible. B. H. pylori infection. This bacterium is a major risk factor for developing gastritis. C. Regular use of NSAIDs. Prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, increases the risk of gastritis. D. Excessive alcohol consumption. Heavy alcohol consumption can irritate the stomach lining and lead to gastritis. E. Stress. Chronic stress and psychological factors can contribute to the development of gastritis or worsen symptoms. F. Smoking. Smoking weakens the stomach's protective lining and impairs its ability to heal, making smokers more prone to gastritis. G. Autoimmune disorders. Certain autoimmune conditions, such as pernicious anemia and autoimmune gastritis, increase the risk of gastritis. Complications of gastritis. A. Peptic ulcers. Long-standing inflammation in the stomach lining can lead to the development of peptic ulcers, which are open sores in the stomach or small intestine. B. Gastric bleeding. In severe cases, gastritis can cause bleeding in the stomach, leading to symptoms like blood in vomit or stools. C. Anemia. Chronic gastritis can interfere with the absorption of vitamin B12, which can result in anemia. D. Gastric cancer. While most cases of gastritis do not progress to cancer, long-standing and severe inflammation may increase the risk of developing gastric cancer over time. Diet recommendations for gastritis. A. Low-acid diet. Avoid or limit acidic foods and beverages like citrus fruits, tomatoes, coffee, and carbonated drinks. B. Non-irritating foods. Choose foods that are gentle on the stomach, such as lean proteins, cooked vegetables, whole grains, and low-fat dairy products. C. Probiotics. Probiotic-rich foods like yogurt and fermented foods may help promote a healthy gut environment. D. Small, frequent meals. Eating smaller portions more frequently can help reduce the burden on the stomach and alleviate symptoms. E. Hydration. Drink enough fluids, preferably water, throughout the day to maintain adequate hydration and support digestion. When to seek medical attention. It is important to consult a healthcare professional if you experience persistent or severe symptoms of gastritis, such as intense abdominal pain or discomfort, vomiting blood or having black, tarry stools, sudden, unexplained weight loss, difficulty swallowing, persistent nausea or vomiting, symptoms that worsen or do not improve with lifestyle modifications and over-the-counter medications. Remember, this information is for educational purposes only. And it's important to consult with a healthcare professional for personalized advice and treatment options based on your specific condition.